Hi, I am Dr. Saqib Mansoor, and today I will discuss with you Morton's neuroma. This is an involvement of the nerve, this nerve entrapment of the common plantar digital nerves in the third web space. This is the first web space, this is second, this is third of the foot. So these are shown the high heels which worsen the condition. So in Morton's neuroma, the patient at times feel that he's walking on a marble and he has continuous pain in ball of the foot, that is forefoot. It is also called an interdigital neuroma and it is a benign tumor of a nerve. Morton's neuroma is in fact not a tumor but rather a thickening of the tissue surrounding the digital nerve that leads to the dose. This thickening can cause different intensity of discomfort or pain in the forefoot that can limit his ability to carry out various activities. Here you could see again that picture. This is the Morton's neuroma, third web space, common site. The front part of the foot, the forefoot has 14 flanges and 5 metatarsals. That you already from the normal anatomy. The web spaces, areas between the bases of the metatarsals, are part of the forefoot. These are the four web spaces. First web space lies between the big toe and the second toe. Second web space lies between the second and the third big toe. I showed you already. I'm repeating. Third web space lies between the third and the fourth toes. And the fourth web space lies between the fourth and the fifth. That is the little toes. So that is, let's see the anatomy of the, condition, the Martin's neuroma. Nerves that provide sensation to the part of our toes are known as lateral and medial plantar nerves. These nerves pass along the plantar aspect of our foot and give branches as they approach near the toes. The branches of the nerve in forefoot at the level of the web space are known as common digital plantar nerves. In a web space, rounded ends of the metatarsal bones get connected to each other by the ligaments known as the transverse metatarsal ligaments. Common digital plantar nerves on plantar side of the foot travel under these ligaments in a web space. Here you could see this. This is the third web space over here. This blue color, third web space, and these are the two nerves which you can see: medial plantar nerve and the lateral plantar nerve. These are the two nerves. This is lateral. This is the medial. The plantar nerves. Here I want to tell you and show you transverse metatarsal ligaments over here. You could see these. So the description, the condition is frequently termed a Martin's neuroma, though your other sources can also call it an interdigital neuroma, interdigital neuritis, and the plantar neuroma, and a Morton metatarsalgia. 8 times commoner in women than men, typically occur in people between the ages of 30 and 60 years. So maybe it's more commoner in women because they wear high heels. The most frequent site for Morton's tumor to develop is in the area between the third and the fourth toes, third web space. I already told you it usually develops as a response to irritation, trauma, or excessive pressure. This neuroma can also develop in the area between the base of the second and the third toe, second web space, though this is less common. This is the usual place of the Morton's neuroma. The commonest symptom is discomfort or pain in the area between arches and toes on the bottom of the foot. That is the ball of the foot. This is, you could see another beautiful picture, the Morton's neuroma. Here, these are the nerves, the common plantar nerves, and this is the thickening there, the neuroma developing the third web space. This is the plantar aspect, and this is the tarsal aspect, the neuroma. Exact cause of the Morton's neuroma is not known, but it is suggested that it may be the consequence of entrapment of the common digital plantar nerves. Told you already. There are no outward signs of the neuroma, normally such as skin discoloration or a lump. The most common symptoms: continuous burning or short pain in the ball of the foot can radiate in the toes, particularly during weight bearing activities like walking or running. Night pain is a rarity. Night pain doesn't happen usually. Patients usually describe sensation of having a marble or pebble under their forefoot while they walk. So symptoms continue. Typically, pain is felt between the base of the third and the fourth toes. That is where the neuroma is lying actually, but it may be present between second and third toes as well. There can be numbness or unpleasant tingling in toes. Sprinters can feel pain when they push off from starting block. This is again that picture. Symptoms: problems with shoe wear are frequent. High-heeled shoes can worsen the condition. I told you already, tight, narrow shoes also worsen this condition as they compress toe bones and pinching the nerve. I told you already, this picture looks good. Right? Symptoms: one must get evaluation from an orthopedic surgeon if one has continued discomfort or pain in one's forefoot. Evaluation with the doctor and the symptoms. The doctor will talk to you about your general health and your medical history and will ask questions about location, severity, nature, and duration of these symptoms. It is also relevant to discuss specific activities you have observed during eliciting of the pain, as they things can bring relief. Changing shoes, rest. Symptoms continue. The doctor will then carry out a physical examination that comprises evaluation of the skin of the foot and ankle for the signs of the excessive pressure points, examination of the position of the toes and foot for the common deformities that can also elicit pain in the forefoot, putting pressure on spaces between the toes to try the pinpoint specific site of the pain, assessing the range of the motion of toe joints as well as the other joints to observe if there is irritation that can suggest joint inflammation or arthritis as a cause of pain. So very interesting. Mulder's click. Squeezing your foot to observe for a click between your toes, termed a Mulder's click, that is at times present with the modern neuroma. Here you could see this is the Mulder's click. Here you could see this. This is squeezing of the toes and a click would be produced. X-rays could be needed to rule out arthritis or a stress fracture of the joints which join the toes to foot. An MRI may be needed in some cases, but this is usually not needed. This is, as I told you already, the treatment. Non-surgical treatment. Typically, initial management of the Morton's neuroma comprise one of more of the following: changes in the footwear. Avoid the high heeled and narrow, tight shoes. Wear wider than with lower heels and a soft sole. This makes bones to spread out and decrease pressure on nerve, providing a time to heal. Orthosis, you can add and metatarsal pads, bars, and custom shoe inserts to your shoes. These can help minimize irritation by a change in the location of forces on the forefoot and separating the bones, which decreases the pressure on the Morton's neuroma. So some injections can be employed for the treatment. One or more than other injection of corticosteroid medication can decrease the inflammation and swelling of the nerve. That brings some relief. Another type of injection therapy is the nerve ablation, where a medication is injected that permanently halts the nerve from sending out the pain signals. So treatment, the surgical treatment, if the symptoms do not get improved or if they return after the non-surgical treatment, the surgeon can advise surgery to either remove diseased portion of that nerve or release the tissue around the nerve. Surgery is commonly regarded as the most dependable type of treatment for the Morton's neuroma, with a success rate of 80 to 95%. So in the last outcomes, conservative measures like activity modification, footwear changes, and additional orthosis can provide some relief in up to 50% of the patients. Corticosteroid injections are successful to relieve Morton's neuroma in about 50% of the time. So, outcomes of the surgical intervention with neurectomy or decompression of the nerve has a maximum success rate with an 80 to 95 success rate. Despite after successful surgical treatment, a Martin's neuroma may come back, then additional treatment is needed. A repeat surgery for the Martin's neuroma recurrence has to be performed. This is the last slide, Martin's neuroma summary. Martin's neuroma most commonly occurs in the third web space. It is important to differentiate a second space neuroma from a second metatarsophrynggeal synovitis. Surgical excision of a Martin's neuroma is usually successful. So thank you very much for watching and listening my lecture. And I request you to support my channel and subscribe it. Thank you very much. Bye.